How to read CBCT for vertical root fractures? 3 people have asked me the same question. Let's get going. Don't forget to save it. Don't forget to share it. Step 1. Start with orientation and windowing. Verify the tooth and side. Align the planes along the tooth's long axis. Adjust the contrast and brightness. Higher contrast to pick the radiolucent line in dentine. Lower contrast or a wider window to evaluate the bone patterns. Step 2. Axial plane, which is the most often revealing. Scroll from the apex to the crown. Look for a true fracture line, which is a sharp, narrow, hypodense line running along the long axis of the root, seen in more than 2 consecutive slices and often traverses the canal space. May produce step-like separation or slight divergence of the fragments. Double PDL space sign. Linear lucency parallel to the root surface on one side, distinct from the normal PDL. Buccal or lingual cortical changes. Focal cortical perforation, fenestration or expansion adjacent to the suspected fracture. Step 3. Coronal and sagittal planes. Correlate the axial findings. Confirm that the suspected line aligns with the root's long axis, is not simply a canal, accessory canal, nutrient groove or imaging artifact. Assess the bone loss pattern, J-shaped or halo radiolucency extending from the mid-root to the apex. Classic but not pathognomic for vertical root fracture. Mid-root vertical or angular defect with relatively intact coronal bone. Loss of buccal lingual cortical plate along the fracture line. Check the apical region for associated periapical lesion. A vertical root fracture often has persistent or oddly shaped apical radiolucency despite adequate root filling. Step 4. Surrounding structures and symmetry. Compare with the adjacent teeth and contralateral side when possible. Map any isolated narrow deep defect on the clinical charting with its CBCT correlate. A deep narrow pocket with a corresponding angular or J-shaped defect and cortical loss strongly suggests vertical root fracture over simple endoperio lesions. Step 5. Grading your confidence. Because CBCT is not 100% sensitive, many authors recommend a confidence scale rather than a binary yes or a no. Number 1. Definite vertical root fracture. Clear hypodense fracture line visible in more than 2 planes plus concordant bone pattern loss. Probable vertical root fracture, no clear line but highly suggestive bone pattern, J-shaped halo, mid-root angular defect or a cortical loss. Strong clinical signs, isolated deep probing, sinus tract tracing to the root surface, pain on biting. Possible or equivocal, some bone changes but could not be